And we are live today. Welcome, everybody, to another episode of the amazing Balance and Empathy show. We are here today with Miss Rena from Australia and Ashok from Canada. And today's topic is about the empathy clinic that Ashok founded in Canada. We're going to talk about this, how he came about to found this, and about his story. So, this will be really interesting. If you are watching, please let us know which country are you watching from, because we want to reach so many people with this globally, and we're very curious where you are based. So let's dive right into it. Ashok, founding the Empathy Clinic, we were just very curious. We had some episodes talking about balance and empathy and kindness and compassion at the work floor, but it all relates to empathy. And you are the founder of the Empathy Clinic in Canada. And I'm just so curious. How did you come about found this clinic?
Well, let me try and keep this answer under 4 hours. I, I realized that I had certain capacities when I was a child. And one of the things that happened to me as a child is I had a bad problem with my leg. And that means that I had to spend 2 years as a cripple. And kind of like Forrest Gump, if you've ever seen the movie. And as a consequence of that, my soccer career was completely over. And I had to spend most of my recesses and my lunch times hanging out with the girls, playing skippy rope. And I realized, no, this is really cool. And I realized that the girls are much more interested in talking about how they feel. They're much more interested in talking about their emotions and their interrelationships with each others. The guys, God love them, were just talking about the ball and if it's going to go in the net or not. And we were just kids between 6 and 8. And I think what happened to me, in a way, is I kind of got hit off course from being sort of more function and solution oriented to being much more interested in what people are saying, how they're saying it to each other, how it's being received, and what's the effect of that. I got really, really interested in human interrelationships really as a child. And by the time I reached my teen years, I realized that there was a lot of change going on in social situations with people, especially the high school effect. And maybe we'll talk about high school as we move along a bit. And then when I got interested in medicine, my first interest was microbiology, which I thought was really, really cool. But the problem with microbiology, you spend most of your time looking down a microscope. And that's really, really interesting. But I also was interested in the macroscope, which is the bigger picture of society, the bigger picture of relationships between people. So bugs and viruses obviously are extraordinarily important, especially during the pandemic, to understand how they relate and how they relate to us. But look at what we've done as a culture in relating to each other. Look at me speaking to people from the Netherlands and from Australia, from Canada. So interrelationships have always been really, really fascinating. Now, the Empathy Clinic is not really a new idea, because I don't own empathy. I have no franchise on empathy, and I'm not selling anything except understanding. But when I got into medicine, the thing that struck me the most was right back like when I was on that soccer field with the lads, and then later on when I was on the recess with the ladies playing skippy rope with them. What's interesting about medicine isn't necessarily the disease and the solution to the disease. It's the people and their relationships with each other. Something called bedside manner is really, really, really important. And also, and this is the main reason why I set up the clinic, is that people will tell you what's wrong with them. They know what's wrong with them. Because if you ask the right questions, if you provide the right listening perspective, which means that you look interested and interesting and the answer is forthcoming, you can find out what's bothering that human being specifically to them, rather than just kicking the ball in the net. You seeing what I'm saying?
Yeah.
Okay, I'm going to let you respond to that if there's anything you'd like to ask.
Well, I just found it really interesting that actually that it's you took us back to your childhood between the ages of 6 and 8. And then that's where the interest really started into noticing the difference in conversation. I find that really, really interesting. And I think, yes, people um, having the conversation is like the most important part in anything you do. Where are persons coming from? The reasons behind their behavior. It all starts with the conversation. So I just want to say it's so fascinating that like your journey into this topic started at such a young age.
Well, I think it started at a young age. Clearly, I had to have the receptor for empathy.
Mm,
And so when we talk about empathy, we assume that everyone has the same amount of empathy, and we really don't. Empathy is
no.
is kind of like a muscle. Some people have a bigger one, some people have a smaller one, and you can always exercise it to make it stronger. And sadly, some people don't have empathy. They don't have very much empathy at all. So they get very saturated with thoughts and feelings about themselves, and that therefore they have difficulty connecting with other people for healthy and full relationships. But what I learned early on in life is that the way I relate to people and the way they relate to me is key in communication and experience, and latterly when I realized what empathy was all about in empathy. And if you want to have a good relationship with somebody, whether it's your partner, or whether it's your doctor or your nurse, or your healthcare worker, if you have empathy with that person, the chances are that what you're teaching them, or what you're trying to learn from them, is going to be amplified so much more than if you don't have empathy.
Yeah, and I think also the success rates of your relationships in every area of your life, also your work relationship with your colleagues, maybe clients that you're speaking to, if you are missing empathy, there's so much understanding missing, I think, which leads to all kinds of problems. So, you're a psychiatrist in Canada. Um, and tell us a little bit about, your interest for medicine. You started to study medicine, you became a psychiatrist, but then the founding of the Empathy Clinic.
Well, I
Did you
think what
start
happened.
out just as a psychiatrist and went from there, or how did that came about?
Well, again, I'll try and keep that one under 4 hours as well. When I started in medicine, I had the same interest that I did as a child in people and their stories. And I realized that medicine was a lot like football again. It had that kind of ball in the net kind of mentality. And I loved learning medicine. I loved learning about all the diseases that people can have and all the treatments. But I really realized that a lot of how people come to a doctor, or how they explain themselves to a healthcare worker, they're frightened. They're scared. They don't know what's wrong with them. They know that something is wrong with them, and they're frightened. And so I began to realize quite quickly, when I was in my 20s in medical school, that that medicine works better, not just if we give them a solution, whether it's a pill, or some advice. It works better if the person feels understood and empathized with. And when I got into psychiatry, now we have a big book here, and it's called the DSM, and it's an American Psychiatric Association manual, and people can look that up if they want to. But all the diseases you're supposed to have in medicine and psychiatry are in that book,
Yeah.
and I think that's wrong. I think that there's people, and then there's diseases that people have. So the same disease isn't the same in every person. And whether it's something like schizophrenia, depression, anxiety, or post-traumatic stress disorder, it's not the same in every single person. It is unique to the way that person experiences it. And so I set up the empathy clinic, not just to meet people and hear about their diseases and fix it, but to understand the person with that condition. And there wasn't any training on this kind of idea in medical school, and there wasn't much training on that in psychiatry. And I'm not saying that psychiatry doesn't have empathy. Of course it does. But I was really, really interested in amplifying that aspect of using empathy to hear people's story and diagnose it. And then latterly, in the therapy that I do, So the empathy becomes part of that therapy. And the result of that, I think, is you get a much better outcome. You have a better relationship with your clients, you have more trust, you're more accurate with the diagnosis because you understand them better, not just their disease, right? It's not just football. It's also that talking that happens on the field with in the recess time with the ropes and the skipping with the girls, right? There's more conversation about the human being who has that condition. And so when people see me, we spend a lot of time getting to know each other. I want to get to know them as a person. I don't want to just get to know them as a disease. Does that answer
Right.
that a little bit?
No, yeah, perfectly, perfectly. And I think I'm not a psychiatrist, obviously, but as I look at it, just my personal view, um, you know, it's so easy. Medicine help, of course, obviously, but I think there's much more to healing a person with only giving them some medicine, because often there's so much more going on, and you cannot cure a person often with just one pill, and also I think some medicines are really helpful in suppressing symptoms, maybe of anxiety or helping people to sleep. But then again, there is something causing these problems. And I think treating people, helping people with these underlying issues, what causes the disease, what causes the problems, it all starts there. And that's why I think it's such a good approach what you do with the empathy clinic, because you're really not just, and I'm sure many psychiatrists also do the same, they're not just focusing on here's your medicine and done with it. No, you really go much more into it as to what is the root of the problem. And I think
Well, I,
that's just fantastic.
I always use the headache example to explain this. So someone goes to a doctor or they're speaking to a healthcare worker and they say, I just got this splitting headache. It's been going on for weeks. And I said, oh, you should try some medication. And they might recommend a number of really effective medications for headaches. And that's a perfectly good solution to that. That kicks the ball right in the net, right? I might also recommend they take a medication, but I'd also ask the question, what's going on in your life? What's happening outside in your life? What's happening in your relationships? How's your work going? Do you have stress at work? How's the rest of your health doing? What kind of things are you worried about? Tell me about that.
Mm.
And then you find out the rest of what might be causing that headache. And so the medication that you give them might help the headache, absolutely, but it won't help the problem that caused the headache emotionally or socially. And I think when you miss that, yes, you're kicking the ball in the net, but you're missing all those other parts of the conversation that will find out the little bits and pieces, and there might be hundreds of them, that are really, really causing that headache. And once you start to deal with those problems, then instead of them having a headache every month, they may not get that headache at all. They may get headaches for other reasons, of course. So I think understanding the person with the headache is always my challenge, rather than just understanding the nature of the headache itself. That's the difference for
Mm.
me.
So, Ashok, it's quite fascinating, and obviously the relationship, the doctor-patient relationship, there's a lot of trust in you and a lot of confidentiality. But you also mentioned that sadly people don't have empathy. So, for people out there in the broader community, what advice would you give them in
If,
relation to empathy, and how could we help each other?
well, I
With all
think
that medical training that you have and the experience that you went through, and looking at it from a macroscopic perspective.
I think my advice to people really is to begin to think about empathy as something that we can improve the quality of. And I think this it's the same thing as air quality. Some places you can't breathe, and then suddenly they begin to fix the environment. I think if we change the general environment of empathy worldwide, which is exactly what I'm trying to do by being on this show, I think if we improve the awareness of empathy and the interest in empathy, then even people who have problems with empathy will begin to clue in a little bit. And I oh, I'm having a problem here.
We lost your camera view.
Yeah,
Yeah, we
I'm
can
not
still
sure.
hear you, but we can't see you.
Yeah,
Yeah.
Shall we bring out
Maybe
the
it's
speaker
just
mode?
pressing a button.
there we are.
There, you're back. We have you back. Go ahead.
So I think what I'm trying to do is improve everyone's interest in empathy. And I do work with some people in my office who technically don't have empathy. And let me tell you what happens with those particular people. Most frequently, they've had some trauma. They've had some terrible traumas that have made them think more about themselves than other people. And trauma can sometimes make people lack empathy while they're going through their trauma, and then lack empathy afterwards because they don't think anyone's going to understand what they've gone through. It's very common, especially in childhood trauma. And so when I help that person go back to that trauma and then provide some empathy with it, it's very, very common that person will come back, sometimes just in a few sessions later, crying. And I say, "What's wrong?" And they're saying, I'm feeling all these things. I'm feeling all these things about the people around me. I saw a stray dog and I started to cry today. I saw someone who's in the streets who may not have had a home, and I went out with them. I gave them all the money I had in my pockets. So I think that it's, if we think that people can't have empathy and won't have empathy, I think that's probably a little pessimistic. And so my advice to people is to have optimism that empathy is possible. And if we kind of serve it to everybody, then I think it's going to increase the world awareness of it.
Thank you, Ashok. We have one question coming in from Vika. So maybe you can explain this shortly. He is asking, what is DSM-5?
Well, the DSM stands for Diagnostic and Statistical Manual, and it's published by the American Psychiatric Association. It's been on the go since the 70s. And about every 5 years, they publish a new incarnation of it based on research in psychiatry. And it's an accumulation of all the diagnoses in psychiatry. And it's used to make diagnoses, is used to do research so that there's kind of homogenization of the ideas, which means that if someone's talking about schizophrenia, we're all talking about the same thing. And therefore, when they set up research trials or medication trials, or then there's some kind of structure and similarity over the diagnosis. So it's a very useful instrument to help us talk to each other more simply than have to go through a long description of what someone's problems are and say, oh, it sounds like, so we just have one phrase or diagnosis. That's the use of it. But it doesn't, the manual doesn't attempt to say why things happen. It just describes what they are. And that's when I got interested also in saying, well, let's look more about why things happen than just what they are. And that's the expansion into that empathy field that I'm so interested in.
Thank you so much, Ashok. We have another comment coming in from Mary Stewart. Hi, Mary. Thank you so much for watching. She says, I work thousands of people and try to teach empathy, and most people have no idea how to be empathetic. And I'm grateful for this presentation. It needs to be shared with all mankind. Isn't that amazing? Thank you so much, Mary. And I wanted to ask you, Ashok, you talked about people, as Rena just addressed, who do not have empathy, but it is like a muscle that you can exercise. So yes, how can we exercise that empathy muscle?
Well, I have a number of techniques that I usually use with couples because I do a lot of couple work. And unfortunately, in Canada, there's quite a high divorce rate. And I'm not saying that's good or bad. I'm saying that's just a fact. And so I often work with a lot of couples, and quite frankly, most couples come to me when things are really going poorly and things are not going well. I don't get couples saying we get along really, really well with each other and we just want to get along even better. And we heard about your clinic and that doesn't happen actually. Most times people are coming to see me and things are already pretty dire. So I have a system called colorpathy. It's like empathy, but I call it using colors. And I use 4 colors. I use red, green, blue, and yellow. And it stands for glad, sad, mad, and frad, and frad is afraid. And so if I say to a couple, let's use this colorpathy process, I'll tell them that blue is sad, red is mad, green is glad, and yellow is frad. Now, those aren't all the emotions, but those are the absolute basic emotions that we're born with as children. And so I get the couple to speak a little bit, and usually no trouble because there's something going on. And then I'll stop them and say, what color is your partner feeling? And then, and so you can either write that down or just know that in your heart, and they'll guess, and then they'll reveal to each other what feeling they actually were having. And what happens in that, usually in about 20 minutes, is they start to get a hit rate of 80 to 90% when I start to doing that exercise, because all they're doing is thinking about what is my partner feeling. And I'll tell you why that's important. When they're talking to each other, they're thinking, well, I'm feeling this, I'm feeling this, I'm feeling this. And then when I give them my little exercise, even when they're talking with each other, they're thinking, what's my partner feeling? What's my partner thinking? They're actually starting to think about the other person in the conversation. And when someone is thinking about someone in the conversation, it changes the tone of it. How many times when people are having a fight, do they say, I have no idea how you feel about it, but I'd love to find out how you're feeling right now during a fight? And that just doesn't happen. What people usually say is, you don't know how I feel, and this is how I feel. And it keeps going further and further and further apart instead of something coming closer together. And so with a colorpathy session, again, like within about 20 minutes, they're actually asking, so how do you feel? How are you? I never knew you felt like that. Yeah, you never asked, or you never listened. And then suddenly the asking and the listening begins to happen. And a couple that comes in fighting, I have a window, I can see them leave the office if I look out the window. They're holding hands going to a coffee shop to talk more about how much they want to hear about each other's lives.
That's so amazing. And does this also go for, because maybe I interpreted it wrong, but you also have couples where there is a disbalance, where one is really empathetic and the other one is not. Does it work the same way then?
Absolutely.
Like the shift in balance in empathy in a relationship.
That's such a great question, teacher. Absolutely. If you have someone in a couple session who is empathic, then they can actually help the other person. But you have to remember, certain emotions like anger make us less empathic. Anxiety makes us more empathic. You know, if you go into a doctor's office and sit in the waiting room, it's quite common that, or especially a dentist, people start talking to each other because they're in a shared stressful environment. You know, what are you here for? The molar. But when people are angry, they become less empathic. And so it's really, really important, especially if someone has more empathy than the other. Maybe the person who has less empathy, maybe they're angry about something. Maybe they've had a trauma. Maybe they simply don't think their partner will understand them. So once you start to explore those tiny places of assumption and doubt, you can sometimes bring a couple together in a way they've never been before.
That's amazing. Thank you so much. Rosemary has left a couple of comments. This is one. She says, my work within the injured worker community starts from a personal knowing and understanding what is lacking in all the professional services. They have everything. Starts with empathy. All manner of conversations and possibilities come into being.
Well, I think Rosemary is correct. I think that if we start with empathy, and let me tell you a story that will make me sound a bit nasty, but here we go. When I started in medicine, I knew I was going to have trouble. And when I started in psychiatry, I knew I was going to have even more trouble because I wasn't feeling like a lot of my colleagues were feeling. They were feeling about, let's learn how to play soccer. Let's get that ball in the net. Let's score. Let's pass and run up the field and get that ball. And I was still stuck on playing skippy rope with the ladies, you know, and thinking, No, we need to understand what's going on here. We need to talk to each other. We need to understand the person. And when I was a medical student, oftentimes we'd have to go into a hospital room and you see this poor person lying on the bed, terrified, and the chief attending doctor would pick up their file and be looking at their chart and saying, well, this person has this disease and this disease. And there were maybe 20 people in the room, and I was looking at this poor person in the bed thinking, oh my gosh, I'm so sorry you're going through this. They weren't even using their name. And then, when we would all leave, sometimes I would go back and just say, look, I'm sorry that we have to do this. Thank you so much for offering yourself for teaching us, but so how are you doing and what's going on in your life? And I used to get in trouble all the time, for talking too much to my patients when I was a medical student. And I thought, this can't be right. This cannot be right. We have to understand the human being who happens to have the disease. Yes, getting the ball in the net is very, very important, but that other stuff is very important too, to not just understand the person, but to get their compliance and their trust.
Yes, and really knowing the person instead of just the file. Rena,
Yes.
you were going to ask something.
Yeah, I would just like to take it back to the days when you were skipping with the girls. Why do girls have more understanding than boys?
I think girls are socialized to be more aware of feelings and emotions, and I think girls are more socialized to talk to each other. And I'm being very, very rough in this description because I know there's lots of boys who are sensitive, and I guess I meet some girls who are insensitive. But I think girls, especially when I was growing up in the 60s, you have to realize that the role models were much more hardwired then. And I always thought that, boys, if they fell down and scraped their knee, there's no way they'd cry. They wouldn't talk about how they feel. They get up and just keep going. If a girl fell down and scraped her knee, and especially if she had a party to go on the weekend, she had a scraped knee now, she'd be very distressed. But all the other girls would get around and say, it's okay, we can look after that, we can help you, and we scrape our knee too. And I thought, there's something community that's happening here that is making them much more safe in that sense of conversation. And let's just take the gender out of it. And I think that when people do admit to each other something simple like, I'm frightened too, or I have those same feelings too, that can make the experience of having that experience, no matter even if it's somewhat unpleasant, much more comforting and soothing.
Very good point.
Isn't that amazing?
Incredible.
We have another comment coming in from Dr. Faraz Khan. Thank you, Dr. Faraz, for watching. He says, yes, empathy and sympathy is two curative medicines due to which you can manage behavioral approach of patients. What do you think about that, Ashok?
Well, I think that I agree. But I think we also have to differentiate what is sympathy and what is empathy. And sympathy is when people have the same feeling about something. They are in simpatico. So if everyone is watching a comedian and everyone is laughing and the comedian is great and everyone's looking around and everyone's laughing, they're sympathizing with each other's humor. If people are at a funeral and everyone is sad and crying and everyone is feeling that feeling, they're sympathizing with each other. So sympathy is when we feel the same thing about a situation or an experience. And that's a good thing to have sympathy. Empathy might also be sympathy because you can feel into somebody's experience and see that they're sad. You may happen to feel sad at the same time. That's being sympathetic while you're being empathic. But for me, empathy is really searching the experience of someone that you may not have. And so you really have to put yourself kind of out of, I tried to go black on the screen just a moment ago. And that's what you have to do with empathy. You have to stop listening to your thoughts, because if you're thinking while someone's talking, you're not listening, so you're not active listening. And you also have to put your assumptions of self out, because that means that if you're thinking, oh, well, if I was in that situation, I wouldn't do it that way. Or why are they being such a wuss? Or, oh my gosh, why didn't they enjoy that more? Those are your experiences. And so when I was a child, my mum was always saying, put on a cardigan, it's cold out. And I said, I'm not cold, Mummy. I'm not cold. She said, well, I'm cold, so put on a cardigan. Yeah, but I'm not cold. And Mum's right? But so I think if I was cold and she said, put on a sweater, and she was cold, we're sympathizing. But if she's saying, put on a sweater, and I'm already sweating because I'm overheating, she's not empathizing with my heat, and I'm not empathizing with her cold. So sympathy and empathy, we have to differentiate just a little bit so we understand it.
I'd be really interested to know what's the difference between engagement then and empathy.
Well, empathy doesn't necessarily cause you to do anything. You can simply empathize with someone and not do anything. The purpose of empathy, I think, is to be able to experience somebody else's experience and then think of something you might want to do. You might have a sense of compassion, and that can lead to a sense of kindness, and that might cause you to want to engage that person and say to them, is there something I can do? So when people come to my office for help, for example, they're already trying to engage me. It's my job to try and engage them right back, make them feel safe, and create an environment for them to want to tell me, not just about their headache, but their whole life.
And I'm very interested to know, Ashok, so you started then the empathy clinic, and I think it's quite different than your standard psychiatric practice, I believe. How is this received in your community? Because I understood, if I understood correctly, that you have a waiting list for treating people. So that's a good thing, not for the people on the waiting list, but then there is such an interest for your treatments.
Well, I think it's received in a sense that people really don't know what to expect when they come into a session. They think that I'm going to find the disease, give them the medication, write a prescription, and maybe 10 or 15 minutes later, they've left the office and they've got the ball in the net. Some people are surprised. I say, well, your first session is going to be an hour and a half. Your second session is going to be at least an hour. And some of my sessions are longer. So it's a bit labor intensive. I understand that. But I'm amazed how time flies when you're empathizing with someone. You're actually going into their story and you're helping them with their life. And then after doing that for a while, they start to feel completely different about their life. So you're not just fixing the reason why they came, you're fixing their entire life for them. You're helping them find that. And I think the beauty of that is to watch people transform from being essentially a person in pain to a person who's now thriving in their life and changing the way they're viewing not just the world around them, but most importantly, how they're viewing themselves. Because when someone truly empathizes with you, you are no longer alone. And once you realize you don't have to be alone, you don't have to be alone, not just with your therapist, you don't have to be alone in your relationships. You can be more vulnerable with your partner. You can be more vulnerable in the workplace. You can start to set boundaries for yourself. You can feel more comfortable. You can feel empowered and strengthened. And it's just amazing to watch people transform and grow. And what's cool about that is that other people notice that. So the effect of empathizing with one person, even if it's just a client seeing me, that begins to help the people around them as well. It seems to just spread as well. And so other people around them, they're not seeing me, are beginning to change because that person might be a role model for them. So that's changing them as well. And that's why I think empathy, once we tell 100 people, we're actually telling 1,000 people about it.
That's so amazing. So the ripple effect is quite huge in that sense.
Always quite huge. And I think that the way I look at it is when I see one person, I know they're connected to all the people in their life. And if I help that one person, I'm really helping everyone in their life. Because that means that the ripple effect of that is that person is now going to be easier to get along with. They're going to be a kinder person. They're going to talk about empathy. They don't have to talk about me. They don't have to say, I met this doctor. They can just talk about empathy. Because my relationship with them is private, of course. But then that gets other people talking about that what can actually happen. Do you realize that there's another game next to the football field called skipping? And you can talk and relate and find out all kinds of things. Really? And now you got the guys leaving the soccer field, coming over to the skipping field, and you got some of the girls playing over in the soccer field. And now we're really understanding each other better more. There was a book that came out some years ago that implied that men and women are from different planets.
Yeah.
And we all know the book.
Yes.
We all read it. And I'm not.
We all do.
I'm not dissing the book. I'm just saying that it's a bit misleading because we are human beings first. And if we treat people who are differently as differently, we're missing out the main point, which is on the inside. We have an alarming amount of feelings and thoughts about things that are quite similar. And when you begin to amplify that, you can amplify the safety of talking to anybody. The vulnerability is safer, the trust is safer, and people actually can bond. And by doing that, I think we can make the world a safer place.
Oh, I agree. I agree. And I think talking about safety, trust, being able to be vulnerable to the people around you, I think it's just amazing. And it's exactly what people need also to move forward, to get that ripple effect that we all want. And I'm curious, I think it also takes away a lot of anxiety that people might have.
Yeah, well, if I can share a story about me and Rena. Rena, do you mind?
Absolutely.
She doesn't know what I'm going to say, though, right? When Rena and I first met, I had to tell her that I had lost my mother to cancer. And Rena's response was so lovely and so warming to me and so kind. I knew almost instantly that I'm going to feel safe with this person. I'm going to feel comforted and safe with this person. And I didn't have to tell her. Of course I didn't. But I felt I had to tell her. And I won't tell you why I told her. That's up to Rena to say. But I think that I think that sometimes when we share a little bit of something that's so private and so painful to us, and you can see the way someone responds, it can really help you find out not just the safety of the relationship, but the type of individual you're speaking to. And both of you are very empathic people, so I feel very safe in these conversations with you. But most of my life, I've not felt very safe talking to people.
Likewise.
I just feel like they're not going to get me. They're not going to understand me. They're going to think I'm weird. I'm weird, but it's not going to feel safe. And then I'm meeting people like you, both of you, and just feeling so much safer that there must be people who are really, really interested in balance and empathy and how we can talk about that so that we can just throw a massive boulder in the middle of the ocean and have a ripple effect all around the world.
Beautiful.
That's so beautiful. Thank you so much, Ashok, for sharing. And I totally agree. Because I think quite soon, I met you after you met Rena, but I think quite soon I really felt comfortable talking about these deep kind of topics, going live and having you with us to share about that. And just, yeah, that goes to show, that even through a screen, and we talked about that in one of the other shows, even through a screen, I just feel the energy, and I just see like the look on your faces, the smile, and you feel warmth, even though you're in Canada, I'm in the Netherlands, Rena is in Australia, really doesn't matter, so yeah, I love we're doing this. I love we're talking about this, hopefully impacting people about this topic and really educating them about how very important this is into creating more understanding and more empathy globally, which I think can just help anyone. We have another question coming in from Neyas Ahmad. I hope I pronounced your name okay. He is asking, what is the difference between empathy and telepathy?
Do you want me to answer that question?
Please.
Well, I think that human beings, so I watch other animals all the time. Okay, this is another little thing I do. I watch ants all the time. Sometimes I watch bats when I see them, but I watch fish and birds all the time. And I'll tell you why. They don't have language that we understand. Yes, birds can call out to each other. Ants, I'm not quite sure. So what ants do, I actually have a video of this. I'm going to post this on my LinkedIn page at some point. They go up to each other and they wiggle their antenna like this for a little bit. and then they walk away and they do something else, and they come back and they wiggle. They actually are touching each other's antenna. I don't know what they're doing, so I need to try and figure out. But what I think they're doing is that they're sending some kind of message. It might be through telepathy, or it might be through their version of empathy. Sperm whales, by the way, can speak to each other across the oceans through sound waves. So they actually transmit information with that huge nose that they have that's designed to amplify sound waves through sonar. So they can speak to each other over the ocean. Are they telepathic? I don't know, but they might be. So I wouldn't be that surprised if human beings have all kinds of capacities that we don't use as much because we have the way we are. But it's a little bit like if someone is blind, they have incredible hearing and smell. Or if someone doesn't have hearing, they have incredible vision. So clearly we can use our senses more. And I'm thinking maybe we can use empathy more, so to the point it could become telepathic. And let me tell you a story, in hopefully less than 4 hours, is that sometimes when I'm speaking to someone, I can sense what they're experiencing just before they've told me about it. Now, I don't say that to them because that would sound weird. That would be creepy. And I might say to them that that if we're moving forward, that I might ask you how you're feeling. That if we can pre-know how somebody feels, that can actually improve our capacity to be in the right place when they need to empathize with. It's a little bit like if we throw a ball. If you know where the ball is going to be next, you can be in the right place to reach it. So I think that's the telepathic thing that might happen when we're move along. I just saw someone said they had an empathy course in 1977, but they just went off the screen.
I saw that. Yeah, it's this comment from Lorenzo. He said, I had an empathy training course in medical school in 1977.
Wow, I didn't. So that's I'd like to know.
I was one at the time. I'm from 76.
Okay, well, I'd like to know what the syllabus was like. But that's fascinating because if I'm not doubting that happened, but that's exactly what I'm trying to do. I've been trying to teach an empathy course at my college and at my school for some years. They're not interested in empathy course. And I think they're interested in kicking the ball in the net. But I said there's other things to talk about. But maybe we'll see. We'll see what they do.
Yeah. Oh, that's so amazing. We have another question, which I showed earlier, from Humayun Kabir. He is asking, is there any relation between empathy and psychopathy? If you could answer that one, Ashok.
Yes, of course. So, but we have to talk about narcissism and being a psychopath and being empathic. So a narcissist is a person who lacks empathy. They know how they feel, and so they're full of their own ego, and they're egocentric, which means that they don't really get how other people think and feel. It's all about them. That's a narcissist. A psychopath, however, might be very, very empathic. They might know exactly what button to push in you to get you to do something. What a psychopath is, that's somebody who lacks remorse. They just don't feel bad for what they do. So if they do something that causes you to be upset, or you lose something, or you lose a lot of money, or you get injured or something, they don't care because they don't have that feeling that most of us have, that we care when someone slips and hurts themselves. And so can you imagine if you have no remorse for what you do? And so you can be empathic towards someone, but you just don't care that you've hurt someone or upset someone. So a psychopath is someone who doesn't care, and that's if someone has been held hostage and they say I have kids and I'm married and don't hurt me, that doesn't work on a psychopath. They don't care. So that's what being a psychopath is. So people often think that psychopaths lack empathy. They actually don't necessarily. It's the narcissists that do. I hope that clarifies that question.
It does for me, at least. I hope for Humayun too. Thank you so much, Ashok. Jan Kuba is asking, hello guys, what should we do when we are provoked in social medias or in our area? Not sure really what you mean, Jan Kuba. If it's in social media, what I do when I'm provoked, usually negative people, hate comments, I do not get into that one. I just remove it, block the person, and I'm done with that. But that's just because I do not want to spend my precious energy on these types of comments or discussion. I think it's a complete waste of time. That's just my approach. But yeah, maybe Ashok, what do you do when you are provoked from an empathy perspective?
Well, Rena, what do you do before I answer?
Well, what I do is I do exactly what Tisha does. I don't engage with that energy. I completely ignore it and I move on because it's draining and it's not worth the time or effort. That's what
Well,
and I do that with people as well, not only from a social media perspective, but, in my environment, I only associate with the people that I share values and beliefs with, because otherwise there's no point, there's no synergy, there's no alignment. And
thank
that's
you.
what it
So,
sounds like.
so I think that is what one should do. But I think that because I am the founder of the Empathy Clinic, and I'm supposed to be empathic, and I get a harsh comment on a site. This happened just last week, ironically, on one of my videos. That I post a lot of videos on LinkedIn, and someone said something that was actually a bit cross with me, and I was initially, I felt a bit upset by it, and I said, wait a minute, I'm the founder of the Empathy Clinic. I have to deal with this. So I, in fact, always comment as empathically as possible to the person's comment. Send them a connection request and say, well, I'll be happy to discuss this with you in a Zoom video. And 99 or actually 100% of the time, they send me an apologetic response in the comments. And most of them refuse to speak to me in a Zoom call. So I'm sure that will backfire one day. But I think when we're working on social media, we really don't know, who people are, and we're really not sure what the true agenda of somebody is. But what I'm trying to do with the Empathy Clinic, especially on my LinkedIn page, is to demonstrate what I can do if someone says something that's harsh to me. And I'm not expecting anyone else to do that. And I'm not saying that that's the right thing to do. That's just, and I don't necessarily do that all the time, but sometimes I do see an opportunity to empathize with the person's comment, say it's perfectly normal that you have that feeling or that thought. I'd like to discuss that with you further if you'd like to. And most people are they're not interested in having a deeper conversation with me, certainly.
Well, I think it's just great that you offer it anyway. I don't do that because
No.
sometimes, depending on the comment, right? Some comments I do just genuinely try to have a conversation with that person. But if it's clearly a hate comment, I do not engage. And Mariah, hi Mariah, thank you for watching, is saying, great answer, Titia and Rena, not engaging with people who we don't align with. Because, yeah, I think energy-wise, Rena is completely right. You have to associate with people who give you energy and who lift you up. But I understand, Ashok, being the founder of the Empathy Clinic and being a psychiatrist, that you have a different approach. Lorenzo actually responded about the empathy course in 1977. He says actually it was an elective course. Maybe, Lorenzo, you can connect to Ashok on LinkedIn. I'm sure Ashok would love to know more about
Absolutely, that would be
this
great.
empathy. Yes, yes. And Yvonne Freund is saying, interesting in empathy course for medical students. Why is it that this is not being taught, you think? Why is it that it is then focused, the education, on kicking the ball in the net?
Because I think that's the agenda. I think the agenda is to learn as much information medically as possible. I mean, I'm never going to catch up with how much medical information is out there because it doubles every year. So there's so many diseases and so much knowledge that you have to learn just to be a doctor and then to go on to be a specialist in something, that the idea of just stopping and just learning how to be a better human being, I think it doesn't always take front stage. But I think that once you get out there and you are a doctor, and I talk about burnout, I've also had a whole part of my practice in dealing with people who are burnt out. One of the reasons people get burnt out is that they begin to lack empathy for themselves, and they begin to lose empathy for what they're doing, and they get stressed because the joy of it is being dissipated. So I think medical schools should have ongoing available training for empathy, and as well as just support. Like, how are you doing? How are you? Is medical school stressful? Medical school is extremely stressful, and no one wants to admit it because no one wants to think that they can't handle it, and they won't be able to graduate. So it's a great big secret that everyone's stressed out, and then when finally you graduate, you say, historically, yeah, that was really stressful. Well, it wasn't the best time of my life. And then you get into a practice, and the same thing happens again. No one admits that they're stressed out. So I think it's key to make the conversation available to people that if you're experiencing stress, there will be kind ears and kind hearts who can listen to you.
I think that's going to be a great topic for our next discussion then. And how to actually manage burnout before it gets to that stage. What are the preventive measures that we need to put in place to avoid?
Yeah, I think that's a great suggestion, Rena, because burnout and empathy are very closely related, and burnout and balance are the same issue, because burnout is an imbalance. So it ties in with our theme very, very well.
Yvonne is saying, okay, I am working at medical school in Sweden, training psychology or psychiatry. She shorted it. So thank you, Yvonne, so much for your comments, and happy that you're watching. Lorenzo is answering, this was at Washington University Medical School, St. Louis. So that's where he got the empathy course. Just this for you, Ashok. And I myself am curious, listening you talking about going through medical school, how stressful this is, not really being taught and educated about empathy. How did you get through this? And what do you do to empathize yourself and to keep that balance?
Well, I think it helps to have a very strong sense of self. And I've always been really attracted to people who have a strong sense of self. And that means that you know who you are on the inside. So I think I definitely was a little bit of an actor in medical school, in the sense that, if I was studying this course, I was that guy. If I was studying this course, I was that guy. But I always knew who I was on the inside to get through it. And I also knew that when I got through my training, I'd be able to do exactly what I was able to do. And I think an important part of empathy is resilience. And I hope one day we can do a show on resilience, because it's such an important point to know who you are going into a complex situation, and that you can retain a sense of self going through it. What happens with some people certainly when they get into med school or any kind of school, is they become their profession. They get into law school, then they become a lawyer. And everyone asks them, what do you do? They say, well, I'm a lawyer. There's nothing wrong with that. But people ask me what I do. I say I'm a musician, because I'm just so musical. And then they say, no, what do you really do? I say, well, I'm an artist. No, what do you really do? Okay, I'm a doctor, or I'm a psychiatrist. So it's the last thing I tell people about me, because I'm not defined by that in exclusion. There's other things that I do. And if you have a sense of self, that can really take you through, like med school or any kind of art, even a difficult job, and you have a good sense of who you are, and maybe you're not getting along with your colleagues or the boss, or maybe the work isn't that pleasant for you. If you have a strong sense of self, you know that you're moving towards your rainbow. You're moving towards a good place that you're going to get eventually. And that's resilience to me.
And I think a key part of that is, when we look at you as a person, Ashok, is the fact that creativity makes up so much of that whole ingredient. Your creativity really comes out. The fact that you do all those beautiful paintings, and I think that's a huge contributing factor. And that's why you're so successful and you are so resilient.
I think the creativity is that we're always creating a version of ourselves in our future that we're moving towards, whether it's a more empathic version, a kinder person. You'd like to achieve some activity. You'd like to climb a mountain or jump out of an airplane, but you're always seeing yourself in your future as achieving those things. And in people call that a bucket list, which is a list of things that you'd like to achieve in your life. And I think my bucket list is the size of the ocean. And so I know I'll never get to all of it, but as long as I'm getting to some of it and doing it and continuing to improve and excel and meet incredible people and make incredible connections, I think it's happening. And I don't have to see the ripples of empathy hit the shores of the world. I just need to hear the splash.
Fabulous vision for the world. Fantastic. Well, hopefully with these discussions that we have on a fortnightly basis, we can help elevate that consciousness and change behaviours. And that's what it's all about, the balance between empathy.
That's exactly right, Rena. I could not have said that better.
Well said, both of you. We are reaching almost an hour now. We keep getting comments in, and I think that's just wonderful. People are so intrigued in this topic. Lorenzo again responded, we were taught to employ empathy in engaging patients. That's exactly what you talked about, Ashok. So that's just wonderful that Washington University is spending time in teaching this. I hope they still do, not only back in 77, but I hope they still do it today. So who knows? And may more universities follow to teach this important topic. As I said, comments keep coming in, so thank you all so much. We have here Yankuba thanking us for answering his question. And I'll just show this last comment from Rosemary Mackenzie Ferguson. Thank you, Rosemary. Coming back to the question I asked you earlier, she says, for me, I know what my framework requires me to be there for others. And she says, it requires me to take time from the work. She says, I sit in my garden, go for coffee, I get lost in a book and simply become still. And I think that's very important into also knowing yourself, simply becoming still, spend time just being with loved ones. She says, because exhaustion overtook her a long time back and it put her in bed for 18 months. And so now she is very aware of the drop points. So I think what she basically is saying that she now has much more empathy for herself and is really careful of not getting to that place of a burnout. So thank you, Rosemary, for that comment. And that is also the announcement of the topic for our next show in 2 weeks. We are going to talk then about burnout. So we all hope to see you back then in another 2 weeks. Thank you all so much for watching today. Let the comments come in. We will try to answer your questions if you have any questions when the show has ended. And we'll see you again in 2 weeks. Thank you, everyone. Bye.
Bye-bye.
Bye-bye.